peptic ulcer disease, it's breakage or a break or ulceration of the mucosal lining in esophagus, stomach, or duodenum, and it can have acute character or chronic. Patient may have superficial erosions versus deep through ulcers. Ulcers may perforate and bleed, causing peritonitis in severe cases. Also, they can bleed inside and causing acute GI bleed, which is also emergency. But in all cases, peptic ulcer disease most of the time is related to H. pylori. This is a picture of chronic peptic ulcer. You see the appearance and the white marking on the edges. So basically mucosa is completely destroyed, and you see like there is some blood discharge going on. It's approximately 2 centimeters in length, or even 2.5, almost an inch. And this may be very concerning. Even if it's chronic, it may exacerbate and perforate. So this may be a chronic NSAID user, like Goodies powder, most likely, or maybe something like, again, H. pylori infection, or altogether H. pylori with NSAID abuse, with cigarette smoking, with alcohol, altogether can cause this. But here you see typical white surrounding in the ulcers, showing that the mucosal layer is already damaged. So it's truly eventually what will happen. This may heal, although highly unlikely, but it may worsen and perforate, and perforation will become into peritonitis and needs again emergent treatment. Patient will. So the key is to address this early, to save patient trouble of dealing with peritonitis, to save them healthcare visit and all the consequences related to it. Duodenal ulcers are the most common ones, and they will be in the duodenum, and again, H. pylori will be one to blame. Basically, H. pylori is a very resilient bacteria that lives in acid and can produce toxins and enzymes that will be promoting inflammation and destruction and ulceration, and also hypersecretion of chloric acid and pepsin will occur. NSAID used to blame gastrin levels if one of the things may be promoting the hypersecretion of acid. And also smoking we can blame on this too. And smoking also has indirect effect on this, because smokers will have lower or they will require more stimulation of taste. So they would like spicier food, they will use more salt, because unfortunately smoking, or fortunately, I don't know, smoking destroys the taste sensation. So you would need more spice, more, if you like hot foods, you will like more hot and spicy food, because your sensation is dull. So that also will promote acid production. So that's why smoking, besides of that, swallowing tar and all byproducts of smoke will be irritating to stomach. But again, number one here is certainly H. pylori infection, which has to be treated. Duodenal ulcer. You see here how this penetrates through layers, the ulcer crater, and mucosa destroyed, and submucosa. It even goes through muscular coat that goes that deep. And of course, this can also perforate. This is a picture of EGD. an esophageal gastroduodenoscopy, and also it shows the location actual ulcer in duodenum. So it's very interesting where it can be, and you see the blood vessels can be quite close to it. I mean, it's a relatively large vessel, and this can cause bleeding. The other problem here, if ulcers appear and then self-heal, lots of connective tissue appears, this can cause pyloric, not pyloric, but it will cause narrowing or stricturing in duodenum and inability to pass food. So patient may have bowel obstruction related to this, so with all the consequences. So another surgical intervention probably would be needed. So duodenal ulcers are common peptic ulcers. Again the same, H. pylori to blame, NSAID use, or NSAID overuse. Couple of words about NSAIDs. Goodies powder, most people who will present with peptic ulcers with Goodies powder, they don't think that Goodies powder is really medication. They think it's just, a powder, something like sugar you take when you have headache, and or people would take it for arthritic pain. But truly, there is no knowledge that it's a medicine. It's not some type of supplement. So that also, in my empiric experience, most of these type of ulcers were caused by Goodies powder. I don't know if there was research done, but empirically, what I've seen, definitely, I can say that yes, Goodies powder was to blame, or other NSAID preparations also may cause this. Gastric ulcers will develop in antral region because it's adjacent to acid-secreting mucosa of the body of the stomach. Antrum doesn't have that much acid secretion, so it's more, let's say, tender. So more, it can be affected much more by acid than the body of the stomach. Again, H. pylori to blame, and its mucosal permeability to hydrogen ions, and gastric secretion will be normal or less normal. Again, it may be even sometimes more than normal, secondary to overproduction of gastrin. But what happened, again, there is something else that causes gastric ulcers. It's not just acid goes from nowhere and decides to, I was saying, it's not like acid goes from nowhere and decides to attack the stomach mucosa, antrum of the stomach, and but there should be something like H. pylori or NSAIDs or stress-induced ulcer. And here's another picture of the ulcer, and you can see some bleeding, very tiny small ulcer. It doesn't have a scale here, but you can see the bleeding in the stomach. It's and you really cannot even say, is this close to a perforation or not? Probably not, but it's significant blood. And this presumptively the photograph taken when patient was presenting with hematemesis, because considering the amount of blood on this picture, and the EGD has been done, and this is before they cauterize the ulcer. So let's talk about liver disorders. Liver disorders can be lots of different liver disorders, but once we truly concern, it's hepatitis and cirrhosis, and depending on the disorder, patient may develop portal hypertension. What portal hypertension does, the blood pressure in portal vein or portal venous system increases because of the resistance to portal blood flow. So this is like in kidneys, can be prehepatic, intrahepatic, and posthepatic. In this class and lecture, I'd like to focus on intrahepatic portal hypertension secondary to cirrhosis and hepatitis, and prehepatic and posthepatic also happen, but they are not truly that common. Portal hypertension by itself, let's say it doesn't have cardiac risk, however, it has very bad or negative consequences. What can happen because of increased hypertension, increased pressure in portal system, patient may develop varices, esophageal varices. Please imagine, not imagine, but that's the true fact, like the portal veins, they go they go to stomach, intestines, spleen, and they merge into portal vein. And the portal vein will branch, then go into the liver and get there. So if in liver it gets obstructed, then patient will start building up the pressure and developing pressure in all liver parts of portal systems. So the esophageal varices may occur, and also hemorrhoids may occur, and splenic congestion or splenomegaly may occur, and also ascites and hepatic encephalopathy because of the inability to get rid of waste products and of ammonia in particular. So let's talk about varices. Varices can occur again in stomach, and they can occur in rectum as hemorrhoids and lower esophagus. Most commonly they will occur in esophagus, and by most commonly I mean the medical emergency wise, they will occur in esophagus. Varices are very vulnerable in esophagus, and they can open and break very easily if patient has somewhat unusual hard food bolus, or for some reason they overate, or without a reason really, because portal veins, and they are not really designed to have that much pressure in them, so they will be rupturing. If esophageal bleed occurs, again, sometime it's very difficult to stop, and patient may unfortunately bleed out in addition to that vomit and aspirate. So this is a true medical emergency. This is when everyone moves very fast in the hospital, as you've probably seen, and most of the I never have seen, and thank goodness, patient being lost secondary to variceal rupture, because we always would take care of it very fast. But there are cases that it's not possible to address this because of the amount of the bleed and of the significance of the veins involved, of how much blood we're losing and how far the patient is from healthcare facility. Esophageal bleed or variceal bleed can be stopped by cauterization and banding of the varices, and the banding technique, same technique, can be applied to hemorrhoids in rectum. The problem with with esophageal bleed versus hemorrhoidal is hemorrhoidal bleed is easier to stop via conventional methods like prednisone suppositories or something else, or surgery, or just banding in the office, and usually hemorrhoidal bleed is not as severe as esophageal. But again, this is a true medical emergency and needs to be addressed very quickly. Any type of blood vomiting from patients, any blood coming out from patient's mouth, it's an emergency, especially if it's a significant amount. Most likely bright red blood will signify esophageal bleed or esophageal variceal bleed, while coffee ground emesis most likely is bleeding ulcer, and melena is also can represent of anything, because melena is nothing but swallowed and digested blood. But esophageal bleed is again very emergent. And in addition to the treatment, in addition to endoscopical banding, patient may be prescribed beta blockers to reduce the pressure in portal system. Because of the increased pressure in venous system, the fluids will be sipping through the vein, and they will be collecting in abdominal cavity and causing ascites. Patient may need interventions as paracentesis to remove extra fluid, and sometimes patient will need lots of produce lots of fluid, 3 to 4 liters or more at one paracentesis session. To deal with ascites, the treatment may include diuretics, and diuretics we may have aldactone and Lasix mix, or combination of aldactone and Lasix to reduce ascites. So hepatic encephalopathy is another complication related, and this is secondary to buildup of ammonia and waste materials and causing cognitive changes. And